Today we will discuss the descent of the testes. Testes descend at the level of the second month of the intrauterine life when these are present at the level of the T10 to T12 vertebrae. Then these testes will reach the iliac fossa during third month, deep inguinal ring during 4 to 6 months. Then these testes will traverse the inguinal canal during the 7th month and then reaches the superficial inguinal ring during the 8th month, and finally they will reach the end of the scrotum at the 9th month. So at the 9th month they will approaches the scrotum. Now, what are the factors which are responsible for the descent of the testes? Number one factor is the hormones, which are testosterone and the maternal gonadotrophin hormones. Then the second factor is the differential growth of the body wall. Third is the formation of the gubernaculum. What is the gubernaculum? I will tell you later on. And fourth factor is the intra-abdominal temperature and pressure. These are the four factors which are responsible for the descent of the testes. Now I will tell you how these factors will participate. Now, as you can see in this diagram, this is the testes and this is the peritoneal fold which attaches the lower border of the testes to the scrotum. This peritoneal fold is known as the gubernaculum. This gubernaculum mainly becomes shortened and will pull the testes towards the scrotum. During the third month, you can see the size of the gubernaculum. During the 7th month, it will reduce. Then at the end, at the 9th month, it will become so small. This is the gubernaculum and this is the testes. So now the testes will be in the scrotum. Secondly, there is a peritoneal fold which is known as the processus vaginalis. This one is the processus vaginalis. This processus vaginalis will descend to the scrotum and it will envelop or ensheath the testes. As you can see here, it will come down. This is the processus vaginalis which is coming down towards the scrotum and then further down, and finally it will reach the scrotum and it will ensheath the testes in the form of tunica vaginalis. So now this is the tunica vaginalis and the connection of the processus vaginalis with the abdominal cavity will become closed finally. Normally this connection should be closed. If this is not closed, then hernias can develop. And we can also have the irregular closure of this opening. So the cyst may develop during this path and this will lead to the formation of the hydrocele. And if the descent of the testes is not there, then we have the condition which is known as a cryptorchidism. So these are the three clinicals, which are the hernias. If there is no closure of the processus vaginalis, so the communication with the abdominal cavity is open. Second clinical is the hydrocele, in which we have the opening, the connection will have the formation of the cyst. And third condition is the cryptorchidism, in which we have the undescended testes. I hope you understand the topic. Allah Hafiz.